So this 2014 paper by Foster et al. Investigates the care of lower back pain patients and whether they should be receiving usual care or a more stratified, organised approach. So lower back pain patients were recruited from family practices or doctor surgeries and were either given education on self-management, either referred on for physiotherapy or referred on for psychologically informed physiotherapy. And what they were referred to was dependent upon what level of risk or severity their pain was, depending on some factors such as location of pain, whether the pain was going down into their legs, whether the pain was always there, without anxious or avoiding their fear. So within the paper, the normal care that's compared against was considered basically an explanation from the doctor that back pain generally resolves itself no matter what we do or like what action's taken, it will eventually heal itself. And then subsequently, this whole study was based upon 6-month follow-ups. So you'll follow up 6 months after the initial explanation it's going to be okay, or 6 months after your treatment. And then changes were dictated by results of a Rowland-Morris questionnaire, disability questionnaire, and just some statistics based on amount of money saved for the healthcare system, quality of life changes, and time off work. So at the 6-month follow-up, what was found was that the group who received physiotherapy from the onset, or psychologically informed physiotherapy, or tips on self-management, they had significantly better recoveries than those who were simply just told it will get better with time. So their disability scores were significantly lower. They had about 50% less days off work, and their quality of life scores was significantly improved, particularly within the high risk or high severity back pain groups. An additional benefit was that the cost of each individual to the healthcare system was reduced by approximately £33. So the study was done in England. So £33, which, for one patient doesn't seem hugely significant, but when you consider the number of patients that come in for lower back pain, whether that be into doctors' practices or physiotherapy practices or whatever locations, it really does start to accumulate and become quite a significantly large number. So how are these findings relevant to experiences in the practice? So personally, as I'm sure many physios have found, that a high number of lower back pain patients come in, they're quite anxious and fearful of movement. And then just through some very simple reassurance, explanation that, movement isn't bad for the back and they need to get moving, get their back stronger. In combination with some very simple exercises, can lead to really some outstanding outcomes for patients and some really quick changes and turnarounds. It just really highlights the importance of educating patients and receiving proper treatment from early stages in their health journey. Thank you.